So understanding the mechanics of the working stroke is probably the hardest concept that students really have a hard time grasping. And I think a lot of it is because so much of it, as you get further into clinic, so much of what we're doing is underneath that tissue. So you can't really see what's going on in there. So you have to be able to understand what you're trying to accomplish and be able to transform that to working subgingivally. Okay, so we're going to go back. That toe third. The toe third is exactly the part that you want to concentrate on. That toe third, I always say, pretend that there's a little flashlight right on the end of that little toe there. And the end of that instrument is going to help you see what is down in that tissue. So the toe third is always the first thing that you want to enter. And I'm going to stay super gingivally. I'm not going to go below. So I'm going to check here and make sure that I have the correct working end. So here I'm on the mandibular now, and I'm going to check on here. I'm parallel with the long axis of the tooth, and my handle is coming out. If I was down here, I'm parallel with the long axis of the tooth, but my handle is not coming out of the mouth. So down here, I want to make sure that I have this end of my instrument. My toe third is going to be the first thing that enters the gum tissue. So you're going to put that toe third against that tooth, and that's what's going to be the first thing subgingivally, and it's also going to be the last thing out. So in a working stroke, you want to adapt that toe third, and the pressure, we're going to talk about lateral pressure. Lateral pressure does not mean to throw all your pressure against that tooth and then with brute force try to pull deposit out. That toe third is what's going to actually be the effective part of the instrument. So lateral pressure means you're going to take that toe third and directionally put your pressure against the tooth, just up at that toe third. So, and then your stroke is going to move in the direction of your toe. So my toe is going to lead me all the way around. It's got the flashlight at the end. That's what's going to tell me what's going on there. I'm going to adapt it. I'm going to put the pressure just against that toe third. So that's where I want my pressure. Too often, a common mistake when you're first is to get in. So you'll get that toe in, and then students drop that fulcrum, and that tip of their instrument is coming out. So instead of in the area where it's actually being able to remove that calculus deposit, they flatten their fulcrum, and they're making strokes. They've got their wrist moving, they've got their instrument moving, but that tip, instead of being down in the area where the calculus is, it's up here. Let's go to an anterior tooth here. So if I'm on this tooth, a lot of times you'll see with instrumentation is people are coming this way. So you're flat and the toe is tipped incisally. It has to stay. You have to come up on that fulcrum, place the toe of the instrument. That's going to be the first thing that you're going to take subgingivally. The pressure is going to be against the tooth. So on the mesial end side of the tooth, your pressure is going to be towards the distal, and your stroke is going to be in the direction that your toe is taking you. So my toe is not taking me this way, my toe is taking me around. So my pressure is towards the tooth and my stroke is towards the toe. Okay, if I was on the back side of the tooth, my pressure is towards the tooth, so this time I'm pressing on the distal side of the tooth. So if you catch yourself in and your toe is coming up, or you're getting sideways across the tooth, you're no longer on the effective part of that tooth. Your toe, so up here, and driving yourself around. Okay. If I take a complex shank instrument, a lot of times, like you saw me up front here, when you take a complex shank instrument in and you're checking to see that that's the correct cutting edge, which we established that this is the correct cutting edge because the terminal shank is parallel with the long axis of the tooth, so that when I come around, once you get that relationship established, that's the effective cutting edge of your tooth. So if you take your fulcrums and flatten them or try to change your stroke to come interproximal like this, you've taken the instrument off the cutting edge. So that terminal shank is to help you throughout your entire stroke to know that you are on the correct part of the tooth, okay? Or the correct part of the instrument to be able to cut the calculus off. So when you're using an instrument, if you're falling flat and you're seeing the terminal shank go across the tooth, you know that you're not on the cutting edge. So as you're practicing, I want you to practice that that toe is going to go in first. Get your flashlight in there. The pressure, the lateral pressure, is going to be towards the tooth, and your stroke, instead of coming back, is going to go the direction of that toe. If we take one and go to the inside, it's the same. That toe has got to go down. Notice my fulcrum finger is up here. If you just slide it across the tooth, you're coming the direction of the toe, which is correct, but you're not, the pressure has got to go against that tooth. There's a big difference between a stroke that you're just pulling and a stroke that pressure. Understanding lateral pressure and to get that feeling of that instrument coming and cutting across that tooth is probably one of the most difficult things to really master. It takes time, it takes practice. But if you're in there and you're just trying to, if you don't have a established fulcrum and you're just trying to pull with brute force that piece of deposit off the tooth, it's not going to work. You've got to use that toe third, and there's got to be, there's got to be a cutting stroke there.